and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi, and I am very excited to bring on for today's guest. But before I do that, wanted to quickly run through a couple of announcements. We have our Breakthrough Innovators Challenge applications up until May 12. All of the information for that will be in the chat if you're interested. We also are looking for sponsors for Women's Health Tech Wednesdays and other HITLAB events. So if you're interested in being a sponsor, use the QR code for all of that information. And we also have our Breakthrough Board applications open. So make sure that you check that out as well. Lots of really great opportunities to be engaged with the HITLAB community. With that, I would like to bring on our guest for today, Nicolette Guillou, who is the program manager at Healthfirst. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Nico, please make sure you pop them in the chat or in the Q&A feature at the bottom of your screen, and I'll make sure that we get to it. So with that, I would like to formally bring on Nico. Thanks so much for being here today.
Hey, Nina, nice to meet you. It's so nice to be here and with the HITLAB community, and exciting week for Kaiser. I was reading about the Geisinger acquisition and the new Verizon Health organization, so I'm sure that's going to be huge for the industry.
Absolutely. I think as you are also kind of in the value-based health landscape, I think there's lots of really great opportunities. So yeah, we're definitely very excited over at Kaiser as well.
Nice.
On that note, would love if you could just introduce yourself, give a background, and really talk about the journey that has kind of led you here.
Absolutely. And hi, everyone. I'm Nicolette Guillou. I've been working in the digital transformation space in some capacity for the past 10 years now, mostly in healthcare and life sciences. So I'm a Mailman grad, and so it's really nice to be back again with the Columbia community. So my role is usually focused in helping organizations adopt new technologies, new ways of working, and deliver the most value to our clients. And so in healthcare, usually that translates to patients, providers, and researchers. Currently, I'm at Healthfirst for a year now, which is amazing. And we're the largest not-for-profit health insurance company in New York State. We serve over 1.9 million New Yorkers from Long Island to Westchester, and we serve some of our most vulnerable residents in the state. We work with over 1.9 million, 40,000 providers. That would be quite an extensive delivery system network, but over 40,000 providers, including our sponsor hospitals, independent provider organizations, and community practices. And what's really unique about Healthfirst and why I wanted to work here is that, as you mentioned, like, we are one of the pioneers in the value-based care landscape, especially in New York State. We were founded 30 years ago by the Greater New York Hospital Association, and we've really evolved to kind of transform the transactional fee-for-service based landscape to a relationship with providers that is really a true partnership, working together on cost, quality, and keeping our members' health and well-being as our North Star. Our vision at Healthfirst is to make healthcare easier and more equitable, so no big deal, right? Easy. And in my role as program manager with the digital provider collaboration team, my role is to help our product owners deliver solutions that enable providers to work with Healthfirst and do business. We want to make it so that providers can spend their time providing care and working with our patients, not spending all their time just trying to make our tools work.
I love that. That is such a good approach. And would love if you could share a little bit more kind of about your background. Was it something that you always knew you wanted to do? What has your journey kind of been like that has led you to this moment?
Yeah, so I used to have a print on my desk of one of Jenny Holzer, the artist's truisms. And it said, if you have many desires, your life will be interesting. So that's kind of the short version of this talk. It's been a varied and kind of winding road, but it's led to a really good place. So I'm a native New Yorker, born and raised in Queens and still in Queens. And as I tell kind of the story of myself, what kind of comes out more and more is the importance of like my early education. And, I spent 12 years in Catholic school. And so that was incredibly formative for me, both in terms of, the educational opportunity and having that structure and that rigor, but also really cultivating a strong sense of social justice and stewardship. And that's something that I continue to prioritize in my day-to-day life. I also spent my high school years at an all-girls high school. And so always being around a community of strong and ambitious women is super important to me. When I started college at Tulane, I was able to find a research program for undergraduate women called Newcomb Scholars, based out of the Newcomb Institute. And the goal of the Newcomb Institute is to advance gender equity through undergraduate education and research and leadership development. So that was a cohort-based program where we learned multidisciplinary research tools, worked on an independent research study, and that's where I really started my path in the field of social psychology and public health. I ended up doing an independent thesis on women's experiences of gender-based violence and health outcomes and the impact. So that was something that really really kicked off my journey. I liked research. I learned a lot, enjoyed doing it, learned a lot about how to manage and use data. But I was really always focused more on kind of implementation and delivery, and wanting to make policy work again, rather than kind of writing the policy itself. So at Mailman, I focused in the health policy and management department, and really kind of learned and continued to hone those skill sets in leadership and management. At the same time, in between, coursework and working kind of part-time jobs, I always found myself drawn to the New York City startup space. So would just go to a lot of demo days and incubator events and just networking, and, just kind of learned and started to meet people. I was pretty hell-bent on working in the health system, hospital space in the city. So it didn't really seem like a viable path for me, to be honest, like to kind of go into that tech startup space. So I just kind of sat with it and always kept it as something I was interested in. So I'll interject here with a little kind of commentary that, the things that you're interested in, you're always going to be drawn to. And so it's a matter of, kind of committing to it and doing it and taking the path of least resistance, or, taking more of a winding road. Either way, all experiences are valuable, and you'll find yourself where you need to be, but just always kind of trust your gut. The things you're drawn to are probably never going to go away. you're always going to want to do
That's good advice. I love that.
Yeah. So anyway, I had the best first job out of grad school. I was working at a health system in the Bronx, implementing a New York State Medicaid transformation program. Some people on the line may be familiar with DSRIP, but was working on that. And the goal of that program was really to transform the primary care delivery system and to scale more value-based models across New York State, similar to the work that we're doing at Healthfirst around shared savings and all that good stuff. So, but by that point, I had really caught the health IT bug fully. I had been working with our Epic team, our health information exchange teams, and different technology vendors. And so from there, I spent the next few years working with a management consulting firm and an AI software company in life sciences to just hone more technology specific skill sets, all while continuing to focus on strategy and partnerships and innovation, all the stuff I like to do and was good at already. So in short, I've had a diversity of experiences, and all of it serves me in my role now. It's really come full circle, and does feel really nice to be back in New York City, working with a hyperlocal organization and serving and providing care for New Yorkers who need the care the most.
I love that. And I love that it's just like, it's, you've grown up in this community, you're like now giving back to the community. So I think that full circle is really beautiful. What a great story. And I love kind of what you were talking about just really knowing that your interests and your passions are going to be something that kind of carry on with you. I think that is like really good as we think about like our careers and our journeys. So I love that.
Yeah.
I wanted to ask you a little bit about kind of what you do at Healthfirst. I know you touched on a little bit about the amazing work that's being done by the organization, but would love if you could kind of walk us through, a day in the life of being a program manager.
Yeah, so every day is a new adventure, but I'm really fortunate to have a great team and great stakeholders that I work with. So again, like my role is kind of just helping the team kind of keep moving forward on the work that we need to deliver. So we develop and launch the tools that providers need to do business with Healthfirst, things like our provider portal, financial and quality applications and reports, health information exchange and operability, and other kind of strategic technology partners and vendors. So I work mostly with our internal stakeholders to make sure that our team is kind of scoping and prioritizing the right work, and that what we're delivering is on track and meeting the expectations of our provider community. We really want our providers to have a good and seamless experience working with Healthfirst. A lot of the role really is just asking the right questions and being a connector. We're a huge enterprise, and keeping that lens is really important to make sure that, whatever we develop works across, the organization and is not kind of creating silos in terms of like data or specifications. So a lot of asking questions. I'm thankful that people keep answering my emails, like asking the same question multiple times. But it's really important, because like getting the basics right around data, specifications, all the unglamorous stuff about digital transformation, that's really what makes the difference. And that's really what I obsess over in my day-to-day, so that we can really, again, serve and keep our providers happy.
That's amazing. Is there like a particular project or initiative that y'all are working on right now that you're really excited about?
Right now, there's always a lot cooking. I think always keeping current with changes and updates around clinical quality measures and population health initiatives. Obviously, working to kind of keep our providers and members connected in care, and of course, always also being dynamic to any new policy or regulations that come through. With software development, like you have a pretty well-planned roadmap ideally. And so still being able to be agile and react to kind of new things as they come up is something that, is important for healthcare organizations, just keeping that flexibility while also delivering and planning work time.
Absolutely. And I think that's actually a great segue because I am so curious. I think, you were mentioning it's really important to kind of have that pulse on what's going on around you. Would love to get your take since you have, you're really serving a community and kind of the work that you're doing. What trends or stories are you kind of seeing? I would say both kind of within the community that you serve, but I think more broadly that you're kind of looking at right now.
Yeah, I mean, in terms of the usual suspects for really good healthcare news, Stat, Politico, Health Affairs, keeping up with those listservs are kind of good practice. I also, seek out and really enjoy reading like beyond healthcare, like more industry agnostic, kind of what's going on with return to work and how organizations are kind of coping and responding with, the upcoming end of some of the public health emergency kind of terms that expanded social safety nets and other services that were not necessarily available before the pandemic. I think that it's kind of a pivotal moment where our institutions will really be shaped for the next many years, and I hope that we can incorporate and maintain some of the best practices and lessons we learned from COVID, rather than just kind of closing our eyes and trying to go back to how things were in 2019. So that's kind of what I've been ruminating and reading about. I'm sure many people on this call have already seen Dr. Murthy's advisory report that came out yesterday around the epidemic of loneliness and isolation, talking about the importance of social connection and treating that as a public health initiative. It's a really good read. It's long, but I thought it was really powerful because it talks a lot about not only the research behind how social connection impacts health, but also prevents, kind of a multi-pronged approach to how organizations, including technology companies, can participate and help kind of foster new and better connections in this kind of post-pandemic environment. There is like a section that's quite beautiful. It's nice to say like a government report is beautiful. So I'm gonna bear with me. Like I would like to
no, share it because I haven't heard
short paragraph. Yeah, it's quite nice. So all right, so this is page 46 for anyone who has the PDF. So such a world where we recognize that relationships are just as essential to our well-being as the air we breathe and the food we eat is a world where everyone is healthier physically and mentally. It is a world where we respect and value one another, where we look out for one another, and where we create opportunities to uplift one another. A world where our highs are higher because we celebrate them together, where our lows are more manageable because we respond to them together, and where our recovery is faster because we grieve and rebuild together. It is a world where we are strong enough to hold our differences, where we are more comfortable and motivated to engage civically, and where our leaders and institutions are more representative of the people they serve. It is a world where we trust one another, where we feel safe to challenge one another and change our minds, and where prosperity and progress are not the privilege of the few, but accessible to all. Amazing. So
That I want to like print that out and cut it up and like put it on my desk. That, I mean, what an amazing like call to action and like North Star for I think all of us to really be working towards. That is incredible. Thank you for sharing that. I love that you just already had it ready on your phone.
no, it I was reading through it on the train, and it's
Okay.
really good. They have like a more interactive, like digestible version too. I know the PDFs can kind of come up pretty small on mobile devices, but
That's
yeah, I think
amazing.
it's just a good reflection, and as you said, like a good call to action as we're all kind of getting more comfortable being in person again and going back to work and just thinking about what we want collaboration to look like going forward. Um,
That.
and I will say just like one more thought on this. I know we're probably short on time, just
No,
rambling,
no, no, go for
but
it.
I was going through the recommendations for insurance companies, and I'm really proud to say that Healthfirst is doing the work. We're in the communities, we're helping people get connected to community-based resources, and really empowering people to live self-determined and happy and healthy lives. Just yesterday, our AAPI Employee Resource Group hosted a event in collaboration with an organization, kind of part of Health First, that focuses on volunteering, both getting employees connected to volunteer opportunities and also kind of showcasing events where community members like lead events like knitting or singing or dance classes. So yesterday, a bunch of us got together in a room, did Tai Chi on Zoom with the community. And
That's
that's
amazing.
walking the walk. Like we're all smiling, laughing, getting some movement in. Like that's social connection in action. And it's up to us day to day to do it. Like no one's gonna do it for us. So that's how we make it happen.
Absolutely. No, I love that. It's like it's a choice that you make and it can be big or small, but the intention behind it and the fact that you are making the choice to do that, I think in and of itself is amazing.
Yeah.
I love that. That's amazing. And I mean, what you're saying about really the power behind community and what that can really do on so many different levels when we think about health outcomes, physical, mental, spiritual health, all of that I think is so powerful. Kind of wanted to ask you, we think about community, when we think about mentorship, collaboration, the people that we have in our corner, would love if you can share a little bit more about, how that served you maybe personally when we think about either the start of your career or even now, what has your own personal community done to support you?
Definitely. And I have always been so lucky to have great mentors. I still count on my mentors, and they've really encouraged me to, take risks and be a leader. And, that's partially why I wanted to kind of do this event today, is because, with remote work and everything, like it is kind of hard to find those, pockets where you can kind of connect one to one and really, share guidance, thoughts, feedback on kind of your experiences. Like I've always learned by kind of observing and connecting with people and doing, and I recognize that it's been very hard to do that. And so in as much as this Zoom can be a resource, it's good practice for me, and hopefully there are some nuggets of wisdom that folks can pick up too. But obviously many of my mentors have been women in healthcare. But I've also had amazing mentors, women and men from different industries, who have really challenged me and pushed me and helped me learn different perspectives. And I would say, when you're looking for a mentor, don't limit yourself necessarily to people that you think embody who it is you think you want to be when you grow up. Like it's really
Ooh,
valuable to just connect with people who care about you and are willing to spend the time, and also knowing that you need to put in the work to be a mentee and reach out and facilitate those connections. And so again, with things opening up again, it's really good time to kind of just start nurturing and building new connections that may have been harder to maintain during like remote and virtual work. Um, and I think like when you are a mentor, you also learn a lot too. And I think in any capacity, like the greatest gift you can give someone is just to kind of accept them and encourage them to be their best self, whatever that looks like, whether or not that's, choices or decisions you would make. But just helping people be their best selves. Mentorship is not necessarily a cloning exercise, but really just supporting and nurturing people so that, again, like just it advances everyone. So it's helped me become a better person and a professional having and being a mentor.
That is amazing. I love that. And I like what you were saying too about, not just limiting mentors to kind of what you are like, that just whoever's kind of ahead of you, kind of on what you are imagining your career trajectory. I think it's just great, not only for diversity of perspective, but that may also change too. So if anything, it's great to be able to have a lot of these different perspectives, because that it may potentially, push you in a different direction.
Definitely, definitely. Good people are good people. So seek them out, nurture it, treasure it.
I love that sentiment. That's beautiful. There's so many other questions I want to ask you, but I do want to make sure that we get to some audience questions that we have.
Right on.
One of them is, how do you see the announcement of the HHS end of emergency rep to the pandemic impacting the community that you serve?
Yeah, it's really kind of a pivotal moment. I think something that is really important for folks to be aware of is that for the past few years, folks who have Medicaid insurance haven't had to re-enroll. That coverage has just been defaulted. People haven't had to worry about it. They've continued to receive insurance coverage, which is amazing.
Yeah.
And with the end of the public health emergency, folks are now going to have to recertify. So it's really important for the community to know that, like, hey, like if you haven't really looked into that, now is a good time, because starting, into the summer months, folks will need to do that. And the worst case is when people go in to get care and they find out they don't have coverage. You want to have coverage before you need care. And so taking a look at that is a really good time to do it. And there's many resources in the community who can help folks get coverage for those who need it. So again, just making sure that folks are aware of that and are taking the action to stay connected. So that's a great question.
Love that. And we have another one that says, do you think the change to requirements for vaccination in healthcare facilities will help with clinical shortages?
I think workforce staffing is a really complex area, and one that I haven't, honestly spent too much time reading and learning about, or involved in more so day to day. I think there are a lot of positions on that area, like in some of the references that I mentioned earlier, like stat, politico, health affairs, folks who are really kind of looking into that. It is dynamic, and I just don't think I have the most informed opinion on that.
Yeah, no worries. Awesome. No, really great questions from the audience. And if you have any, please make sure that you chat or put them in the Q&A section. Wanted to ask you, I think, really where you are in your career and kind of all the work that you've been doing. Would love if you could, give any advice, if you have any words of wisdom, either for your younger self or, those that are just kind of starting off in their career journey. Would love if you could share any insight.
Yeah, definitely. I think this younger generation of women are so cool. I think they're so talented and, are a lot freer than some of like the social norms than my generation even was impacted by. That being said, as like we were talking about earlier, like it has been really difficult for, this younger generation coming into the workforce during the pandemic to, I think, benefit from a lot of the kind of opportunities for mentorship and on the job, like in-person training that I was, for example. So I would say that, anytime that you can take out and, again, be a mentor and help, shape the generation is really important. Give people the opportunity and help support them so they can grow. Some advice that I wish I had growing up was, just how to self-advocate for what's okay and not okay, and how to set boundaries. I think that, sometimes lean in culture, we interpret that as like doing everything 1,000%. And, that's not really fair or sustainable. And so that was a lot of kind of independent study that I needed to do is on how to kind of manage and develop those skills in my life. So if anyone's interested, like I did a lot of pandemic reading, and one of the books I really loved was Boundary Boss by Terry Cole, because it really helped me understand the different cultural traps around overdoing and people pleasing and how that shows up in work. And what also is valuable about the book is that it has different activities and scripts so that you can go through and kind of incorporate more of those techniques with the support. Like, obviously you don't know how to do something until you learn it. So the tool kind of breaks it down. And sometimes even before a difficult conversation or a call, like I'll kind of skim in the appendix and just read up and make sure I know kind of the right way to frame things. So it's yeah, it's a lot of self-learning, but I think that's something that, you know, has really served me and already paid dividends.
That's amazing. And that's really interesting, kind of bringing up like the cultural context around Lean In and like kind of who are the ones that are quote unquote being tasked or kind of expected to even be doing that work, I think is really fascinating. And good book, Recca. Like, I'm going to keep note of that, definitely. That's
Right
amazing.
on, it's a good one.
And also wanted to ask, I mean, you know, when you think about the work that you're doing, I think especially in this, you know, current context with a lot of the regulatory changes that are happening and you kind of being in value-based care, like I would imagine that's kind of a lot of the work that you're going to be really involved in. And I would imagine it's, you know, probably pretty stressful kind of having to go through and do, you know, be doing all of this work. You know, for you, how do you kind of deal with either kind of challenges or stress in kind of your day-to-day? What are some of the ways that you kind of mitigate that? And I love that you were kind of bringing up a book that has a lot of great exercises. I'm sure you have some pretty cool tips and tricks for managing stress or challenges too.
Yeah, I mean, if anyone's a pandemic reading list or the mindfulness podcast list, I can
Love it.
put together a file. But yeah, I mean, stress is part of life. And if we didn't have stress in our lives, things would probably be pretty boring. So, you know, we don't want to we want to solve for the stressors we can, but we can't totally avoid it. And so that's where kind of good emotional agility comes in. Something that I love to do and is really important for me is a metta or loving kindness meditation practice. And so comes from Zen Buddhism, and basically it's you know, kind of reflecting on expanding circles of compassion for yourself, for near and dear ones, and then for all living beings. And so that helps kind of bring good feelings and feelings of interconnectedness. And so you know, spoiler, like sometimes the self-compassion is the hardest part, but you know, being really consistent with that practice has been really valuable, because how you show up for yourself is ultimately how you show up for others. And in healthcare and other caregiving professions, you can't do the work that you need to do if you're not taking good care of yourself.
I love that. And I also realized we're at time. How did that happen? It just flew by. But I think that's such, if anything, just a beautiful way to end it about, you know, just having that self-compassion. And I think that that is really great advice. You've given a lot of just really good nuggets of wisdom today, Nico. Like that's been amazing.
No, thank you for a great conversation. It's been really fun, and hope to chat with you again soon.
Yes, we'll definitely need to do like a part 2 or some other kind of coffee chat with all of us very, very, very soon.